Good afternoon to all my senior faculties, my colleagues. Today I am Dr. Shangita Mukherjee is going to present an article on the journal Club. The title of the article is Effectiveness of Pulmonary Function Test as Elective Module Among Undergraduate Medical Students. It is done in a government medical college at Kolkata, West Bengal. It has been published in Indian Journal of Physiology and Pharmacology. It is a reputed journal and it is indexed in Scopus and MBIS, and Scopus site score 2023 is 0.5. The abstract that has been stated by the authors background is the elective module in medical curriculum was introduced by National Medical Commission to provide ample opportunity for the students to opt for any course of their choice not covered in the traditional syllabus. These will help them to enhance their knowledge, skill, creativity, experiential learning, communication ability, team-based collaborative learning, thus developing their personal and professional confidence in dealing with resource-limited, unfavorable circumstances. The objectives, as mentioned by the authors, is a pulmonary function test is a widely used investigations for diagnosis and monitoring of patients having respiratory complex. So in block 1 physiology, they chose PFT as an elective module since exposure of undergraduate medical students to PFT is inadequate in formal medical training. They introduced this elective to sensitize the future physicians about the importance of PFT, attract their interest in the subject of physiology, and motivate them to choose physiology as a career preference. Regarding methods, in the abstract they stated that it is a quasi-experimental study. It was conducted in the Department of Physiology, the setting in which college it is not mentioned in the abstract. 32 MBBS phase 3 students, they have participated. They assess the improvement in knowledge and skill by comparing pre-test and post-test results. They have used the Kirkpatrick evaluation model level 1 to record the reaction of the students and level 2 to evaluate their confidence regarding PFT after the course. Thematic analysis was performed on the perception and feedback of students and faculties. The result in the abstract section, they observed that all 32 participants showed statistically significant improvement in both knowledge gain and skill development. Thematic analysis of responses of students pointed out strengths, weakness, and suggestions for betterment of the module. The SWOT analysis of the perception of faculties guided them to devise a modified framework for the implementation of the PFT module in the future. Conclusion: the elective module of PFT was implemented successfully in their institution with a positive impact on students, assisting them to progress from basic comprehension of physiology of lung mechanics to independent interpretation of PFT reports, to utilizing PFT in clinical reasoning and decision making. The keywords they have used are elective, pulmonary function test, perception, medical students, physiology. Now come to the article proper. So in the introduction section, the background, they told us that elective provides the opportunities to gather new information. An elective module contributes both towards the professional and personal development of medical undergraduate. So what is the rationale of the study? They mentioned that in recent times, they have seen a decline in the number of medical students choosing a career in preclinical subjects in physiology. So to retrieve the interest of students in the field of physiology and to sensitize future physicians about the importance of pulmonary function tests, they decided to introduce the PFT as an elective module in the preclinical physiology block 1. And another rationale, PFT is an important diagnostic tool for deciding treatment plans for this lung disorder. So they undertook this educational approach of incorporating PFT so that to ensure that novice learners become well acquainted with the relevant principles of physiology so that they can apply this concept in the analysis and interpretation of reports in clinical practice. And it will also enable the undergraduate phase 3 students to acquire knowledge about the indications, contraindications, precautions, interpretation of result, and as well as to develop the skill of performing PFT on subjects and patients independently before they enter their actual professional life. This will also enhance their career options in choosing professions like physiologists, researchers, or pulmonologists. Now, research question, as it is made from the study design and methodology, that more precisely, does participation or in a structured elective module on pulmonary function test improve the knowledge, clinical skill, and confidence of MBBS phase 3 students, and what are the students and faculty's perception on this module? So this is the research question. And hypothesis, the null hypothesis is that it is based on the study design and objectives that I derived, that implementing null hypothesis is that implementing PFT elective module has no significant effect on the knowledge and skill development and the confidence level of undergraduate students. An alternative hypothesis, implementing this PFT module, it will significantly improve the knowledge, skill development, their confidence, and also it will be perceived positively by both students and the faculty. So the objective of the study, they have stated that their first objective was to organize an elaborately designed activity schedule in a specific time frame for the implementation of PFT modules as an elective. Another second objective was to evaluate the effectiveness of PFT module as an elective, and the assessment of perception and satisfaction of students and faculties about the module was their final purpose of the study. Now, material and method. The study design, it is a quasi-experimental study. They told it is a mixed method study. Setting is Department of Physiology. Here they have mentioned that Government Medical College of Eastern India. Participant phase 3 part 1 MBBS students, 2021 batch. Sample size is 32 students. Inclusion criteria, students opting for physiology elective with 75% attendance. Exclusion criteria, non-consenting or not giving informed consent, and less than 75% attendance or incomplete responses. Duration was 15 days as stipulated by NMC. It was done between 27th May to 12th June of 2024, 2 hours per day. Intervention, PFT module with lectures, hands-on practice, patient testing, interpretation, and seminar. So this was the module they have formed. The learning objectives at the end of the session, they will be acquire knowledge about the indication, contraindications, importance, procedure and precautions of PFT. They will be able to perform the computerized spirometer on patients independently. They will be able to interpret the reports of PFT and diagnose various respiratory diseases. So according to their schedule, on day 1, they will take the informed consent, pre-test and pre-course survey and the introduction to PFT. In second, third and fourth day, they will give the lectures on PFT, and on fifth day, they will show the patient, that is a demonstration. Then from 6th to 9th day, there will be hands-on training, and from 10-11, there will be interpretation of PFT reports. On 12th day, there will be formative assessment, post-test and practical examination. And on day 13, the seminar presentation, perception of students, logbook submission. And then day 14 and 15, there will be post-course survey, reflection writing, feedback suggestion and perception of faculties. So now how they have assessed the knowledge gain and the skill. Pre and post knowledge assessment they have done by validated 10 item MCQ based pre-test and post-test via Google Forms. Skill assessment was done, 20 mark practical exam OSCE on the procedure and OSPE on interpretation. Feedback tool, they have used Kirkpatrick level 1 and 2 5-point Likert scale plus open-ended questions. Qualitative analysis, they have done the thematic analysis based on the Braun-Clark's 6-step method process, and SWOT analysis for faculty feedback. Statistical tool, they have used SPSS version 25. Sapiro will test was done to see that their data is normally distributed or not, and pair t-test they have done. Wilcoxon rank sum test for the pre and post course survey rating, they have done this test. Now come to the results. Regarding the student demographics, the total number of students was 32. Out of them, 8 was female, 56%, and 14 was male, 44%. Their average age was 22.78 years, plus minus 0.87. Now the quantitative analysis. So for the quantitative analysis, they have compared the pre-test and post-test score by using the paired t-test and also the practical test, and they have stated that there is statistically significant difference between pre-course and post-course test score, depicting significant knowledge gain and improvement in skill. Then the qualitative analysis of the questionnaires. First, they have studied the perception of students of PFT elective module on the basis of Kirkpatrick level 1 reaction evaluation model. So this Kirkpatrick evaluation level 1, it is a tool to evaluate the participants' reaction to a training or educational interventions. It includes some aspects like satisfaction, how satisfied are you with the training session, then engagement, how engaging did you find the session, content and delivery, relevance, how relevant was the content to your academic and professional needs, instructor effectiveness, rate the trainer's knowledge and clarity, environment, was the learning environment conducive to learning, and open feedback, one open-ended question. Rest of the all was 5-point Likert scale, and what did you like or dislike about the session. So based on these framework, they have framed the questions like whether objectives of PFT elective module are clearly stated. So that was and whether content of PFT module adequate. So that it goes under the satisfaction group, I think. Whether procedure of PFT was properly explained, that is also in the satisfaction group. Whether teaching and demonstration was interesting and informative, that is the instructor effectiveness, they have written it. Whether adequate time was given for practical session, that is also the engagement, and whether proper infrastructure was available, so that is the environment, and whether the module enhanced their knowledge and skill, so that is their satisfaction level. Whether I am satisfied with the choice of PFT as elective module, whether PFT module motivates me to do further research in PFT, would I recommend other students to take PFT as an elective module. Okay, so these are the things, but relevance point is not cleared here. So as per their interpretation, majority of the students, they were satisfied regarding the content and teaching learning process. Few students expressed their discontent with the time allotted for the practice session, 25% of students, and inadequate infrastructure, 15.63% of students. Now the second thing they have done, they have compared the pre-course and post-course survey score of perception of confidence in knowledge and skill of PFT module. They have done it on the basis of Kirkpatrick level 2 learning evaluation model using the Likert scale. So in this model, there are grossly 5 domains usually seen. One is a knowledge domain, that is they have separately, it is done by the MCQs. Skill domain, they have done the OSPE also separately. Attitude, that is to assess the change in attitude towards the topic, and confidence, to evaluate confidence in applying knowledge, and commitment, to measure intent to apply this learning, that is application of this knowledge in future. So depending upon this structure, they have framed these such questions, that I am aware of the different kinds of PFT, it goes under the segment of knowledge, that I understand the importance of PFT, I know I have knowledge about the definitions and normal values of different parameters in the PFT, I am aware of the indications, contraindications of PFT, all are under the knowledge. Then is a clear idea about different types of respiratory diseases, differentiated between obstructive and restrictive lung diseases. So all comes under the knowledge section. Then I know the precautions to be taken, and this is also in the knowledge section. I feel confident in performing PFT on patients, that is the confidence thing, and the commitment, I am able to interpret the results on PFT, that is also on the skill domain. But attitude and commitment, this was not clearly mentioned in the questions. They have interpreted that the statistically significant difference between pre-course and post-course survey scores, they have Wilkinson method of statistically they have done it, and post course survey scores demonstrated marked improvement of the students in achieving the objectives of the module. Now the responses of the students on PFT elective module, that is the thematic analysis they have done. They have divided the themes into three areas. One is the strength of the module, weakness of the module, and what are their suggestions. Regarding strength, majority of the students found the content educational in enhancing understanding and bridging gaps between the traditional curriculum, 62.5%. They told that it is informative and relevant. 56.25% said that they got the hands-on training opportunity. 53.13% said that the faculties were very helpful. So there is a strong mentorship and instructional support throughout the module. 46.88% said that it was an enjoyable, unique experience for them compared to regular coursework. And 43.75% they told that improved clinical understanding. It indicates successful translation of theoretical knowledge into clinical application. Regarding weakness, 56.25% pointed out that there is no weakness. 28.13% they told that limited time of practice, more hands-on practice they required. 6.25% stated time consuming assignments, students are burdened by seminar logbook requirements. 6.25% they told that mandatory attendance is too rigid, attendance policy perceived as restrictive by some. And 3.13% stated excess academic load. So elective overlapped with core academic responsibilities. Regarding suggestions, they suggested that 68.75% make the module more clinically oriented. Majority recommended expanding real patient exposure. 25% said that enhance interaction and group activity. It should be more. 18.75% told that improve equipment access. That is infrastructure support needed to ensure all the students should have hands-on time. Then 9.38% showed that add research methods or data analysis and indicates desire to build a scientific foundation for future research. So, and 6.25% relax attendance and logbook demands. That was their suggestion. So overall interpretation was the elective was overwhelmingly perceived as useful, enjoyable and clinically relevant. Hands-on activities, guided mentorship and new skill acquisition stood out as key strength, and primary areas of improvement centered on time constraint, workload and infrastructure limitation. Feedback suggests students are eager for more clinical and research oriented exposure. Now SWOT analysis of the faculty perception they have done. This is the graph or figure they have given. So from it can be interpreted the faculties they have said that they perceive that the module is successfully captured the students' interest. It promoted active participation and aligned well with the defined educational goals. They pointed out the weakness as operational challenges like resource scarcity and tight schedules were seen as barriers to smooth execution. Opportunities, they saw the faculties saw the potential for broader curricular reforms and research cultivation using such electives. Threats, institutional inertia and heavy regular academic load were identified as risk for sustaining such innovative programs. Overall interpretation, faculty perception supports the module value for applied learning and clinical readiness. Implementation hurdles were more logistic than conceptual. Positive faculty outlook aligns with the student satisfaction, but sustainability depends on system level adjustments and support. Now regarding discussion. So discussion point number 1, they have pointed out the significant improvement in knowledge and skill, and this was in agree with the studies published by the Mahajan R et al. Into 2021 and Wag et al. 2022. So there is a strong evidence of learning gain and consistent with national and international studies. Second discussion point was the hands-on training and student engagement. Active participation was observed. So it also agrees with Agarwal et al. 2025 and the Ramalho et al. 2020 publications. So hands-on modules are engaging and elective competency in elective competency development. Third point, they discussed about the elective enhance the clinical reasoning and diagnosis. So they have gained the confidence to interpret the PFT report. It agrees with the Lishind et al. And Alkhanin et al. In 2018. Students' clinical application of knowledge reflects deeper learning. Fourth point, they discussed about the promoted for professional and personal development. Students develop time management, teamwork, self-directed learning, but no such table is also given in the methodology section or the result section. But it agrees with the Vidija et al. That is module addressed affective and cognitive domains of CBME. Now, statistical students' recommendation and future interest. So, 84.38% recommend it for the future students. So, this supports the findings from the Chatterjee and Core. So, positive feedback aligns with other electives showing career influence. Elective improved the perception of physiology. Elective made physiology more relevant and engaging. This aligns with Longhurst et al. 2020 publication. Elective provides transformative learning opportunities that align with NMC elective goals and support smart learning. So it matches the concept outlined by Lamb and Murdoch et al. 2004. Okay, and preclinical elective on PFT is a novel contribution. So no prior Indian study reported on PFT as elective module. Authors claim that their novelty not directly compared in previous Indian literature. Now, limitations of the study, they mentioned that it has small sample size, no long-term behavior tracking, Kirkpatrick level 3, it has been done. So, conclusion, PFT elective enhanced learning and motivation, highly accepted by the students and faculty. And future directions, they will implement it in their institute and develop modules for other diagnostic skills. So they have no source of funding, conflict of interest was zero, and ethical approval, it has been provided by institutional ethics committee. So these are the references. Now come to the critical appraisal by the MHPE, mixed method appraisal tool, because they have said that they have used it is a mixed method study. Now MHPE or mixed method, it focuses on 5 key domains. It is actually a structured appraisal tool to evaluate the methodological quality of mixed method studies that contains both qualitative and quantitative data collection and analysis. It focuses on 5 key domains, that is the screening questions, qualitative domain questions, quantitative descriptive type, and the mixed method questions. Regarding the screening questions, are there clear research questions? Yes, they have given a clear objectives. Do the collected data allow to address the research question? Yes, pre-post tests and feedback align with the objectives. Qualitative component, is the qualitative approach appropriate to answer the research question? Yes. Thematic analysis used for open-ended response. Are the qualitative data collection methods adequate? Yes, open-ended questionnaires they are given and SWOT analysis used. Are finding derived from the data? Yes, trends, weakness, and themes clearly drawn from data. Is interpretation supported by data? Yes, quotes and percentage supports finding. Is there coherence between data sources and analysis? Yes, Brown-Clark's 6-phase framework, it has been followed. Regarding quantitative descriptive component, is sampling strategy relevant? All students are included. It was small sample size, but it was relevant. Are measurements appropriate? Yes, MCQs, Likert scale, OSCE, OSPI, they are aligned with the outcomes. Are outcome data complete? Yes, all 32 students, they have participated fully. Is there low risk of bias in the data collection? It is unclear. Possible social desirability bias in feedback, it is there. Is statistical analysis appropriate? Yes, unpaired t-test, Wilcoxon test, p-values has been reported. Now, mixed method component, is a design relevant to address the research question? Yes, mixed method justified by the objectives. Is integration of qualitative and quantitative data clear? It is partially. Data presented separately, but in the discussion segment, the integration is not that much stronger. Are the interpretations adequately derived from the data? Yes, supported by multiple data points. Are divergences between qualitative and quantitative results are addressed? No. No discussion on conflicting views or negative cases is there. Is there justification for using mixed method? Yes, to assess both performance and the perception. So overall score in qualitative, it is no flaw is detected. Quantitative, potential response bias, it is not addressed. Mixed method, limited integration at the result, no discussion on the negative findings. So overall MMAT rating is 13 out of 15. Now what is the key strength of this paper? That is clear objectives and mixed method design, significant quantitative improvement supported by robust statistical analysis, rich qualitative data with thematic and SWOT analysis. What are the key limitations? As it has been mentioned by the author, no exploration of the conflicting or neutral responses in the qualitative analysis, limited generalizability due to small sample size and single institution setting, integration of qualitative and quantitative finding not clearly synthesized in the result section. So what could be the suggestion to do better in this study? That duration and timing for practical session. So they have not mentioned that how many patients the students have done by their own. Okay, there must be a clear cut standard. The 5 patients they have to be done by individually under supervision. So and the time allocated for hands-on PFT practice should be more, because students have mentioned that the infrastructure was not good, so that every patient from that it was a bit clear that all the students did not get adequate or exposure to hands-on activity. Integration of research components. So in the objective section they have stated that so this module will will induce the students to take more career as a physiologist and researcher, but no such research methodology teaching learning has been introduced here. So basic research methodology sessions and can be included here. Flexibility in attendance and assessment can be thought of, because students thought it is a bit restriction for them. Expansion of the clinical exposure, and one other important point, this affective domain is not included. Okay, so what is the behavior with the patient, how to maintain the privacy of the patient in the especially in female patients, what is their behavior with their peers, their behavior with the non-teaching staff. This could be included into the study for the betterment. And how many patients they did individually, it was also not mentioned. Sample size and generalizability, increase the participant pool across multiple institutions, can improve the external validity. Now diversity in the teaching method can be done. PBA, problem based learning, that can be included, and focus group discussion could be done to get deeper understanding of students perception. Then evaluation framework enhancement, incorporate Kirkpatrick level 3 to assessment the long term effects of it, and whether they are following it in, there is definite change in their behavior and they are applying it in the clinical setting. Out of this mmap tool, I have a few points to say about this article. Choice of the journal, what went well is it is an international journal, open access, peer reviewed, reputed journal, indexed in NMC approved indexings, but the acceptance rate is 7%. So a journal with higher acceptance rate could be a better option for them. Now the title, what went well, it is a narrative, it describes the essence of the work, but study design and study settings could have been mentioned in the title. Regarding abstract, it is well structured, but background has no separate section. In this in the abstract section, maybe it is a policy of the journal, or language could be much better, because they have started it. The object is we are selected pulmonary function test, a widely used investigation like this, so it could be more crisp. And how it will help the students to choose physiology as a career in future, it is not clearly mentioned. And study stating, in the abstract they have mentioned only only the physiology department, medical college from which area they have not mentioned. In the keywords they have not, it is not given in the alphabetical order. Regarding introduction, what went well narrated, explained the scientific background and rationale for the work. All 32 students responded, so no non-response bias is there. What could be done better? The first objective was to organize and elaborately design activity schedule for PFT. They have showed the schedule, but nothing is written how they have developed it. Sampling technique. So it is a census, that is, they have taken all the students and sample calculation is not mentioned here. So, and as they have mentioned it, it is a quasi experimental study. As per my knowledge, quasi experimental study is, it is a study aims to evaluate the effect of an intervention or on the, especially on the health education. But there should have been a comparison group with the control group and the actual group. So no control group is there. So I don't know whether it is good to say it is a quasi experimental study. And how, I have already said that how it will help the students to choose physiology as a career in future, that is not clearly mentioned. So why I have chosen this article? Because my own project is based on elective in physiology, which includes PFT and ECG. Hence analysis of this paper will enhance the understanding of my work. Thank you.